Hi, I'm Seneca Smith, and I'm here with Dr. Laura Conway, the Assistant Director of Genetic Counseling at Arcadia University. How are you, Dr. Conway?
Fine, thank you, Seneca.
Good. I wanted to ask you a few questions today. Can you tell me a little about genetic counseling?
Sure. Genetic counseling is a process where counselors meet with patients and their families when there are concerns about a condition, a medical issue running in the family that they might be at risk for. We talk with them about what those risks are, whether there is testing available, whether they'd be interested in that testing, and then when the test results are back, how do we interpret them, how do we help them move forward.
Okay. All right, can you tell me, what does a genetic counselor, what do they exactly do?
Well, when we meet with families and patients, they come to our offices and we typically take a very detailed family history where we ask about all of their close relatives and whether there have been medical issues, when they started, what was done, what's known already. And then after looking at that family history, then we spend a lot of time talking with them and getting a sense of what's appropriate for them in terms of what their goals are for treatment and testing options.
Okay, all right. How, can you tell me, I want to know this, how can a genetic counselor help me or someone, anyone?
Well, one of the things that we ask people to do is to spend a little time asking their family members about what medical issues are running in the family. So the more you know about your family history, the better off you'll be in the long run. There are actually online tools available where you can get forms that will help you collect that information. Then you bring it to your doctor and review it with them, and they'll often make a judgment then about whether a meeting with a genetic counselor would be a good idea for you. But honestly, if there's anything running in the family that you're concerned about, I'd recommend talking with your doctor about it and considering a genetic counseling appointment.
Okay, so you're a genetic counselor.
Yes.
Where would a genetic counselor work?
A lot of genetic counselors work in hospital systems. They work in doctors' offices. The areas that people have worked in the most often have been in prenatal genetics, where people are concerned about risks to their children, in pediatric genetics, if they have a child who is already affected with a condition, excuse me, or in cancer genetics, if there's a history of cancer running in the family. But we see counselors spreading out into other areas now, like ophthalmology, cardiology, even psychiatric genetics. And then counselors also work in other areas. We have some alumni of our program who work as executive directors of advocacy organizations for particular genetic conditions like Friedreich's ataxia. We have alumni who are working in public health, a lot of alumni who work in research. So there's a lot of jobs available for people who are trained as genetic counselors.
Okay, so it's not just one area. Okay. All right, now can you tell me, are there different types of genetic counseling?
Well, really, we do focus on these different areas. In terms of the counseling itself, it's the same kind of method that we use in all cases, looking at family histories and interpreting those results. But the different subspecialties vary, like I said, so cancer, ophthalmology, cardiology. There's really been a big branching out into many aspects of medicine these days. Even some of the common conditions, we're starting to understand more about them and how genetics affects them, like high blood pressure, diabetes. So more and more, I think genetics and genetic counseling is becoming useful in the medical setting.
That's great. All right. Now, I want to know, is it common, is genetic counseling common? Is it like, I know I've read, like I said, I've never really heard much of it, but is it common now?
It's getting to be more common. That's one of our concerns, is how well the field is known. I think it's becoming more and more well known. I see more mentions in the newspaper. But there's only about 3,000 genetic counselors in the country. There are about 35 genetic counseling programs, and Arcadia actually has the second largest genetic counseling training program in the country. So it's not as common as we would like it to be. People always say we have a need for more counselors, but there's more and more of them available every year. Genetic counseling is a great career, personally, I think, for people who have an interest in science and medicine, but people who also like to talk to people. So many people, when we talk to applicants, we hear a lot that they were interested in science, they were interested in research maybe, but they didn't want to work in a lab all day long. They wanted to get out there and talk to people. Genetic counseling appointments typically last, say, anywhere between 20 minutes and a couple of hours, so we have time to talk with patients that sometimes doctors and other health professionals don't have. So it's a very interactive field. It's a very caring field. We talk with patients. We really do a lot of the counseling as well as the genetics. That's an important part of the field. So for people who have an interest in both of those aspects of patient care, it's just a great area to work.
Okay. Now, speaking of education, what is the highest level of education that you need?
In order to be a practicing genetic counselor, you have to graduate from an accredited program, and these are master's level programs. So we typically accept people into our program who have bachelor's degrees, most often in biology or psychology, but as long as they have the background in biology and psychology, we will take people from any major. Then it's a 2-year program where you get a master's degree at the end, and then you can sit for the certification exam and practice as a genetic counselor.
Okay, so you're saying that a person in any program can go into genetic counseling, or they have to be like, considering like biology or, something in the health field. So would it have to be in the health field?
Well, you have to have taken certain prerequisites. So
Okay.
in order to enter the program, you have to have taken a certain number of biology courses, psychology, chemistry. So you have to have that background to begin with. But we've had people enter our program who were anthropology majors or business majors, people who have been out working for a while in other areas. So you have to have an interest in the field, certainly,
Okay.
but we don't require that you have had a bachelor's degree in biology or psychology.
Okay, now, with you talking about the program, can you tell me a little bit about the program here at Arcadia?
Sure. As I said, we're the second largest program in the country. That doesn't mean we're very large. It means we typically have a class of around 12 to 15 students. It is a two-year master's program, and our students come in and take courses here on Arcadia's campus, and then they do clinical rotations. We are the only program in the Philadelphia area, and so we have access to clinic sites throughout the greater Philadelphia area, including places like the University of Pennsylvania, Drexel, Temple, Cooper in New Jersey. We send people down to Christiana in Delaware, as well as the DuPont Hospital for Children. We send people north into New Jersey as well. So we have terrific access to the clinic sites here. The Philadelphia area has a wealth of resources that are available to people, and so it's just been a wonderful experience working here as the only program in Philadelphia. The availability of interesting genetics and clinic sites is just fantastic.
That's really great. Now, can you tell me what has been some of the medical advances to genetic counseling?
Genetic counseling has changed dramatically over the last few years. We have found that the technology is increasing rapidly, so that when we look at genes, so the instructions that make people what we are, it takes about 3 billion base pairs, building blocks, to make up the 25,000 genes you need to build a person. And with technology advances now, we are able to look at almost all of those genes at once for a total of less than about $10,000. So the amount of information that is now available is enormous, but the challenge for us has been finding out what all that information means. So genetic counselors are spending more and more time helping people trying to understand these test results. Things that we were never able to even do before, we're able to do now, but the challenge now is finding out how to figure out what those results mean, what we can do with those results to help patient care in the long run, how can people interpret them, and how can people convey that message back to their families, since genetics is all about the family. We have, going back to the Arcadia program, our medical director, Ian Krantz, is a geneticist down at the Children's Hospital of Philadelphia, and he is putting together a short course for our students on this new technology. And so we're very involved in making sure that our students stay up to date in all of the cutting edge technologies that are becoming available. We want our students to be able to practice with the best and most current medicine as soon as they graduate from our program.
Okay, great. All right. As you said, when you graduate with, degree working in genetic counseling, is it difficult to find a job after graduation?
No, actually, I think with this increasing technology that's available, there have been more jobs open. So the field has expanded. Our graduates have been very easily able to find jobs. Our current graduating class this year is about 17 students, and we expect the vast majority of them to have jobs by the time, shortly after they graduate, if not by the time they graduate tomorrow. Many of them already have jobs. And traditionally, our classes have been fully employed by usually the end of the summer. So employment has not been a problem for our graduates. They've done very well.
That's great. All right. Okay, well, thank you, Ms. Conway, Dr. Conway, excuse me, for answering my questions, because there were some things I did not know. So I'm glad you were able to answer some stuff for me.
Thank you,
So thank you. I'm Seneca Smith.